We are dealing with equipment issues, mainly because I forgot my equipment to use today. But hey guys, welcome. Coach Josh here from CrossFit Metro East, Dill from Myo-Fit STL, and we're here to talk to you a little bit about tendonitis, tendinopathy, tendon issues. What are all the tendon type things, right?
Yeah. Tendinosis.
Tendinosis, yeah.
A lot of different.
A lot of tendon issues. Yeah. So this conversation kind of popped up because we've been talking a little bit about having some like interior elbow pain, so your tennis elbow, your golfer's elbow, different things like that. And so there was some things that you felt like, hey, there are, kind of the ways that you treat this or you go about this when you're working with clients. So I just thought, honestly, this is something that pops up. Either it can pop up because of work-related issues, so the ergonomics in which you work, or even just kind of the repetitive activities that you do at work, or in the gym training and, or being a runner, whatever else it may be. So I just thought, this is probably a common enough issue that it would be good to kind of give some quick hits on maybe some self-care things that somebody can do, but also maybe how you approach it with from a rehabilitation standpoint.
Yeah, so a couple of things there. It's important that we really look at these tendon issues when we have them and understand whether it truly is a tendonitis or a tendinosis, right? Okay. I think that's the big thing there is because a lot of tendon issues we see over time, they've been around long enough, they no longer have that inflammatory state.
So that's right. So yeah, to clarify, the itis aspect is really the inflammatory state, correct?
Correct. So we see swelling and redness and warmth, at the tendon. Whereas, as those progress over time and they linger, that inflammatory phase goes away, right? And we get this more of a pain at the tendon, but it's not an itis any longer. It's more of a tendinosis or a tendon that may be, for lack of better words, dying, if you will, because tendons don't have real good blood flow.
Right.
And so I think it's important that we talk about that just a little bit from that perspective, because everybody wants to classify tendon pain as tendonitis, and that's just not always the case.
Okay.
And so there are some differences maybe in care when it comes to those things. From my perspective, when it's an itis, right, we have that inflammatory thing. We need inflammation for healing.
Yeah.
And so that's an important piece. But we also want to keep that inflammation in check.
Yeah.
Right. And so we do that through limiting some of our activity and so forth. So we don't have this constant overuse of an inflamed body part. Right.
Okay.
And so, but when we look at the tendinosis piece, where we no longer have that inflammation, we really want to recreate inflammation at the tendon. And some of the techniques we use will do that. So we're trying to create micro bleeding and so forth in order to bring chemicals to the area, really to promote healing, right? Yeah. We need those chemicals to come in and clean up the area and heal.
Okay. So how do you assess that, or how does say somebody's not to you yet, how does someone, or how would somebody begin to understand or maybe have an idea of, is this an itis or type situation?
Yeah, and I think I touched on it a little bit. We see those kind of 5 cardinal signs of inflammation, right? We see pain, we see redness, we see swelling, we see warmth, and typically some sort of lack of motion or along with those. And so we see those things with the tendonitis individual, right? Yeah. Those 5 cardinal signs of inflammation.
So now it moves to more of that tendinosis type scenario. So maybe could there still be discomfort there, right?
Absolutely.
Yeah. So but maybe that discomfort's a little different. That the type of pain maybe they're having, or when it's painful, or
it could be painful, all the time still in the same way. But we really we don't see those red and swollen, and we see the tendon that looks and kind of acts normal, right? But it's painful.
Yeah.
Right.
Gotcha.
And so that's kind of how we see the difference of those two.
Okay.
One of the kind of nutrition hacks I wanted to touch upon as far as caring for those, even in just whether we're injured or not injured, is using a supplement called collagen.
Okay.
Right. We know there's 28 different types of collagen roughly in the body. 90% of what the body is type 1 collagen. We're talking about, things like tendons, ligaments, bones, etc. Right. And so the body will use that collagen to help repair those things. Yeah. Right. And there's a guy I think he's out of California, and I can't recall exactly what school that he does his research out of, but he's used and studied collagen for a long time and looking at tendon health and so forth. And so what he has found is that if they've studied 15 grams of collagen, using 15 grams of collagen about 30 to 60 minutes prior to this kind of targeted tendon exercise. Okay. Right. That lasts less than 10 minutes. Right. That they see over time that the body will take that collagen that we've consumed and will actually use it at that location to create healing. Wow. And so they've seen tendons that have, that osis kind of piece, tendon dying and so forth, where the tendon has actually showed on imaging that we have this dying or necrotic kind of tendon. And they've seen over a 6 or 8 week period where that thing has doubled in thickness by using collagen and so forth. And so we certainly can use that. And I recommend that often with my athletes, is using collagen when we're dealing with these tendonitis type issues.
But you're talking about it specifically kind of within that window of time, or is it, it's probably not detrimental to have it at any time, but in that window of training specifically. Right. And then you mentioned like that kind of tendon specific or concentrated training. What does that look like, or what might that look like?
So it would look different for everybody or each body part, obviously, but thinking about like maybe a runner who has some patellar tendonitis or tendinosis, right? It might be they're doing front squats or decline kind of squats that are really targeting the quad and placing stress along that patellar tendon on the front side. And again, the length of those exercises aren't drastic, right?
10 minutes.
It's less than 10 minutes.
Yeah, okay.
Right? And a lot of times they talk like 6 to 8 minutes. Even. Gotcha. But we're doing a very specific targeted focus on that care or on that stress, right? Might be, if we got an overhead athlete who's got some rotator cuff tendonitis, we're going to focus on something to stress that tendon overhead or in a way that's stressing that specific tendon for, those exercises. Right. It might be, banded external rotation or whatever it might be. Sure. And so, but this research is extremely interesting for that perspective, right? Because people really struggle with managing and dealing with tendonitis, tendinosis. Right. And, they've even gone as far as to say, if you have a problem area that you've had in the past, that you can kind of pre-treat this even, right? And say, and by doing that same targeted, taking our collagen 30 to 60 minutes prior, and then doing this targeted exercise for that particular tendon area, right, as a way to kind of pre-treat and to prevent, if you will, that tendonitis from coming back.
Okay. Yeah, I have always taken my collagen in the morning with my coffee, just because that was like years ago when I started. And here's the deal: I don't take collagen because I was like, oh, I have tendonitis, I'm going to start doing this. I was just taking it because I was like, I think it's good for me. I'm supposed to take this, right? Yeah. And we have it. But I would always put it in my coffee because it's flavorless. It doesn't, it's basically, there's nothing to it. And it was just something extra for me to do, but I never thought to do it, before training until you kind of mentioned that concept to me. Are there like some, and obviously the it depends answer is always there, with when it comes to, anything training and rehabilitation and that sort of stuff, but everything's case by case. But are there some things that you really like to focus on in, say, the itis phase, the tendonitis phase, and the inflammatory phase for someone, dealing with any sort like that, no matter what the tendon
Right.
or where the area is, these are the things I'm going to be doing with a client to help them manage that inflammatory phase.
Yeah. And so, really we're looking at trying to find the cause, right, of why did we have this inflammation of that specific tendon? What dysfunctions do we have, right? So we're looking up and down the chain of why do we have that dysfunction there?
Yeah.
Right. And a lot of times we find issues, right?
Sure.
Up and down the chain. And so that's really the first thing for me. Like I'm not looking specifically at, well, this tendon specifically is inflamed and so forth. My goal is to find out why.
Yeah, that's the symptom, right? They're experiencing a symptom at the tendon,
right?
But the cause of that symptom could be, like you say, up or down the chain, meaning like, if it's a knee, it could be up at the hip, it could be down at the ankle for the person. It's like, what does that mean, right?
Yeah.
Uphill and downhill. Totally. Okay, so
yeah. So that's the first thing for me. I want to find out why.
Yeah.
Right. What things do we have biomechanically that are placing more stress in that area, or what are we doing training wise?
Okay.
Right. Have we done, are we doing things like, I'll take rope climbs for instance, because we have the ropes out today, right? And so have we done a bunch of rope climbs, and then are we a construction worker and we've been swinging a hammer all day, and maybe, then on the weekends we have, we're doing something else, playing golf or whatever, and we've just continually repetitively stressed that medial elbow, for instance, right?
Yeah.
And so, I look at these other factors,
right?
Like what else do we have going on, and where can we address those things?
Okay.
After kind of diving into that, one of the main things outside of nutrition that I use to treat tendonitis is tendons really love eccentric loading.
Okay.
Right.
Yeah.
So they like this load that, there's stress on the tendon as the tendon's being forced to be longer.
Lengthened. Okay.
Right. Lengthened.
Yeah. Mm-hmm.
And so they just do really well from a recovery perspective on that side. And so I really encourage eccentric exercise.
So for example, if you're a listener or watcher and you're not sure, like, okay, what does eccentric load mean? It might be, say someone, we'll focus on the arm here, it's not the curl up of the dumbbell, it's the lowering down. And that's a slow lower, time under tension, or that tempo that we talk about. And that slow lower down would be the eccentric, because there's load and it's resisting that load while it's lengthening.
Correct.
Okay.
Correct. Yeah, so I really use that a lot with my tendonitis folks, tendinosis folks, as a way to target that tendon and so forth. And they do very well with that.
Gotcha.
And so other things, just making sure our tissue length is appropriate.
Sure.
Right. Obviously, if we have a tissue that's tight, up or downhill, right, we're going to cause more tension on that particular tendon. I think about my runners and maybe having either some quad or hip flexor tightness, right? Well, there's going to be more stress down at the patellar tendon, right? And so, make sure we're treating or stretching those things appropriately, and really taking tension off if we can.
Yeah. So. Is there any shift, like from going from that inflammatory phase into the osis, or that dying tendon, that changes with care and treatment? Or
can you rephrase that? I'm not sure I quite understand.
So I guess, somebody comes to you and they have that tendonitis, right? And so they've got inflammation. You're looking up and down the chain on the inflammatory side of things, or what's causing the inflammation. Right. You're addressing some nutrition from that perspective, and then you mentioned the tendons really like that eccentric type stuff.
Yep.
But if somebody comes to you with more of an osis, right? Yeah. So they don't have inflammation. Right. So they're not. But then, is there a different form of treatment that you might perform, or is it still kind of the same process?
It's similar.
Okay.
Except for the fact now that I want to create inflammation.
Okay.
Right. Because I want the tendon to have this micro bleeding, if you will.
Yeah.
Right. And so we'll use things like instrument assisted soft tissue mobilization. We might use cupping. We might use a variety of those types of treatments in order to create some micro bleeding at that site.
Yeah.
Because we want the body to the body didn't heal appropriately, right? It got
Right.
out of that inflammatory phase without healing,
Yeah.
or it sat in that phase too long and eventually becomes this itis or this osis, right? Where it didn't heal.
Yeah.
Right. And so now we want to re-stimulate bleeding in order to have those chemicals come in to start to fight that and heal the tendon and so forth.
I think, well, and the reason I ask that is because I think that we have a lot of both parties, right?
Yeah.
We might have someone, and you know, the reality is that we're pretty safe with the way we train our clients.
Sure.
But I'm not going to say that sometimes somebody doesn't come in and they've got something that's inflamed, and whether that's from something they did in their backyard, you know, doing yard work, or they did in a workout. There's some that might be like, hey, this is hurting me, and this is hurting me from this exercise yesterday, right? I remember, and this, you know, so that very much is an inflammatory phase. And then we have those clients, and sometimes these clients come to us, and sometimes they're new clients that maybe haven't exercised in a long time, or so they might be walking in with issues that we've never even seen before. And they're like, I just have this elbow that always bothers me. And maybe it's bothered them for 10 years. That is much greater of like a chronic type issue. And so I just was curious, like there's probably a different approach to each. And I was just curious of how that works, because I think it's important that I know you and I have talked about this with clients too, is a matter of like, the person's like, well, it just kind of always bothers me, but it's fine. It's fine. Like, and so they always, it's like the client that's dealing with this issue. There are things that you can do to help that long-term irritated tissue, or not, I shouldn't say irritated or inflamed, but you know, that tissue that's been bothering for a really long time, and it's fine. Well, if it's causing discomfort or dysfunction, it's not fine. And there are some things that we might do differently with that. So
and it kind of makes me laugh a little bit, because it makes me think about like basketball players I've treated in the past. They're like, hey, I have tendonitis, patellar tendonitis. Like, oh, you do? When did it start? Oh, I've had it for years. You do not have tendonitis
for years.
For years. Right? Like, there's no swelling, there's no inflammation. Like, your tendon hurts because it's necrotic, it's wasting, and we really want to stimulate some blood flow there.
I think you hit on two things that I just want to like highlight to the listener that is important. Number one, if you have an acute or an inflamed tendon situation, you mentioned the person that goes to OSIS is because something didn't heal correctly. And so for that person that like might have an initial issue, and they're like, oh, well, I'll just, you know, I'll rest it for a couple of days, or I'll sit out for this. Like during that inflammatory phase, there are things that like need to happen correctly for it to heal correctly to avoid the OSIS, right? And so to that person, like this is one of the things that you do, not only for the public, but for our clients as well. Our clients actually get this included, is that injury evaluation, right? And it's a quick hit, and sometimes it may not move to anything more in depth, but just having that quick injury evaluation to say, I hurt this yesterday, can you take a look at this, is probably extremely important for them to get through that inflammatory phase properly. One, and then even for the client that, or for the person that maybe isn't one of our clients, they can actually do that, you know, it's a small fee, but it's so important to assess that at the inflammatory phase so that they can get through that successfully, or they're going to potentially wind up in this OSIS phase, which is more of that chronic long-term issue. But then for the person, then I think about like the OSIS person. So they're out of that inflammatory phase. I've had tendonitis for years, right? No, you haven't. But then even for that person, how important is it for you to be able to look at that person too? Because what's the long-term, you mentioned like the dying of a tendon. I think about that, like something in my body's going to die on me. Like what's the long-term issues there?
So
that someone should be concerned about.
The tendon starts to weaken, right? Because it's not healthy. It doesn't have great blood flow. Tendons in general don't have great blood flow. And so once they start to weaken and die, if you will, become necrotic, right? Certainly we have an increased risk of rupture. Right? We've seen folks like basketball players, right, who have had these, you know, had tendonitis forever, right? Not tendonitis. And they go out and they jump one time and they rupture the patellar tendon. Right. Or, you know, we see that with a bicep or whatever, right? Like, so those things certainly can happen, right? And they do. Sometimes with like the elbow, for instance, that pain is there for so long, people end up having surgery to get part of either the flexor or the extensor cut out because it's necrotic and it's causing pain. And so, sometimes there's some surgical fixes from that perspective and so forth. And we really want to avoid, obviously, that long term, right? Because it's not fun to rupture a tendon. It's not fun to have those.
Bill still thinks I'm going to rupture my Achilles tendon from a college injury that he
no, not at this point.
Not
there
yet.
was a point in time where I thought you were going to.
I stopped dunking a basketball, so I don't have that problem anymore.
Yeah.
Spud web over here. So
exactly.
Okay, so anything else that we haven't hit on that you feel like is important for folks to kind of know about as we talk about this tendonitis, tendinosis stuff?
Yeah, I think one thing going back to that nutrition piece that I didn't mention is collagen really needs vitamin C.
Oh,
right?
Yeah.
In order to help transport. Right. So we need about 500 milligrams of vitamin C at some point before that collagen ingestion. Right.
Okay.
And so it could be, an 8-ounce glass of OJ in the morning, and then you're taking this collagen, an hour before you do your tendon health exercises or your tendon specific treatment. It could be a vitamin supplement. It could be a variety of things.
I thought about this because I've actually not been taking my collagen before with my coffee in the morning. But I've also not been taking it before my training. So I'm just not taking it at all right now, I guess. But I was trying to think about the timing of it because you had mentioned some of this stuff before we recorded this. And one thing that we do, that we just have kind of packs in the house, and I was going to ask you about this, is the emergency packs, right?
Yeah.
We take them, I'd start taking them with the zinc and stuff before, if I start feeling something come on or whatever else. And there's one thing about vitamin C that I've learned from just other folks that have done some research things on this is your body will absorb the majority of vitamin C that gets put in. It's one of those supplements, one of those vitamins that really the body utilizes very well.
Yeah.
So I will take those occasionally. And I thought, well, what if I could probably take this with my scoop of collagen protein in that realm. But you're saying even as long as it's in the system just prior to taking that. Okay.
Yeah. So the body just needs to have the vitamin C available in order to help transport
it.
And so it could be at the same time.
Right.
There's nothing wrong with that.
Sure.
But it also could just be that we're making sure we have our appropriate amount of vitamin C for the day.
Yeah.
Prior to taking that. And so that's important. Just helps transport it.
Yeah.
They've done, Dr. Barr, again, being the main researcher there, they've done research on the use of vitamin C and not using vitamin C with collagen, and they found that they need it to transport.
Vitamin C is okay.
And so important finding there.
Yeah.
The other thing I'll tell you is some collagen supplements do not mix well with cool or cold water.
Yes. Yep.
So
that's what started my coffee scenario years ago. Yes. Yeah. I don't know what the name of that is. There's a type of they specify that type that does not. Yes.
Yeah, and so it'll just clump up.
Yeah.
And it's miserable to ingest at that point.
I did it with Vital Proteins was the brand. Now Vital Proteins probably is readily absorbable now.
Yeah.
But that was
it's still in cool water. It does not.
Oh well, see, then that's so Vital Proteins don't do Vital Proteins in cool water. Then.
Yeah, I did
that years ago.
Quite a bit, because they're readily available, right? It just cool water they don't mix well. And so what I've encouraged my athletes to do is actually collagen as a whole, as a supplement, does not break down in hot water.
Yeah.
From a degradation perspective, right?
Yeah.
The water would have to be 1,000 degrees or something crazy in order for it to start to break down.
There is a denaturing of protein sometimes within hot fluids with some of our whey proteins. So that's what he's getting at here is this doesn't do that.
This doesn't do that. And so what I've encouraged some of my athletes to do is, make some hot water, and it may be, I don't know, a couple liters or whatever, and they can put all of their collagen in there and mix it.
Yeah.
And then put it in the fridge if they wanted it cold with a protein shake.
So it won't break down once
it won't break down. It's not going to dissolve out of the water.
Yeah.
And so it's all there and it's available.
That's a really good trick.
So I've encouraged that on occasion.
So don't be like me and try to drink vital proteins with cold water because it doesn't work.
No, it doesn't work.
But that's a great.
It does work in coffee.
Yes, it does work in coffee.
Yeah. It does
Now, so we carry Earth Fed Muscle is the company that we use on our collagen protein. We also there's a couple of different options. I believe Driven Nutrition also has some collagen options as well. You mentioned type 1 collagen, right? That's what somebody's looking for.
Yeah.
Or is that pretty much predominantly what's available?
That's what we're gonna find.
Okay, that's what I assumed, but
because it's 90% of all collagen that we have is type 1, and that's really what that the collagen supplement is going to be.
Okay, yeah. So the Earth Fed Muscle that we have will blend in cool water, so you don't have to worry about that. So if you're one of our clients and it's on the shelves, it's available. It's in a smaller container. Now you said about 15 grams of collagen. So you may want to check the labels on that because I'm trying to remember as I look back. I think our Earth Fed Muscle might be a 12-gram serving.
Yeah.
So you might want to do like a heaping scoop of that maybe.
Yeah.
And then about 500 milligrams of vitamin C. Okay.
Now, depending on what version you buy, some of those already put the vitamin C in.
That's
And
nice.
so I would look at the label.
Yeah.
Because obviously they're becoming more and more aware of vitamin C being the transporter.
Right.
And so they'll just include it in.
Yeah. Okay.
And so
Coach Alyssa usually has 4 cuties on her at any time, those little oranges. So she's probably good on her vitamin C.
Yeah, probably.
But I would need to probably supplement that. And my kids, they drink a lot of orange juice. I only drink orange juice with mimosas. So I don't know if that's included, but I guess if it mixes up in cool water, it would also mix up in cool champagne. Right. So that'd be fine. Okay. Yeah. I don't normally do mimosas before training though. All right. Well, so recap here. So number one, if you're someone that's currently dealing with what we would call like a short-term issue of pain, there's redness, there's swelling, there's warmth, there's things like that. That's kind of that itis, that tendonitis phase potentially. Come set up a consult and get that thing assessed so that Bill can look up the chain, down the chain, find out what's causing that. Because typically you're feeling the symptom of something else that's being incorporated in there, or what you're doing is truly your activity is specifically inflaming that area. Also, if you're the person that's like, well, my elbow always hurts, like it's fine, also set up a consult so we can see what's going on, because what we don't want to run into is the long-term effects of that necrotic type tendon that could lead to ruptures or surgical issues, things like that. It's preservation of our tendons and tissues and just our body in general to continue to function. Also, if you're someone that maybe just wants to either be proactive, one, or potentially you do have some of these issues, one thing you can do right away is 500 milligrams of vitamin C and 15 grams of collagen. Make sure you pay attention to how that dissolves. Other than that, and then anything else?
One other thing came to mind. Jello is actually a collagen. And so
JELLO, that's what the vital protein situation is, because it's gelatin type.
Yeah.
Yes.
Yeah. And so Jello, is also something you can use. So if you
we can literally just eat Jello.
You could.
Wow.
Yeah.
That's awesome. Yeah. My grandma makes Jello. I'll try some of that. Yeah. All right. Well, cool. Well, Bill, once again, I really appreciate this. If you guys want more information about Myo-Fit STL, you can check it out on social media at myofit.stl. Yeah, let's say that. Okay, cool. On Facebook,
on
Instagram. We've got links everywhere in our emails and things like that. If you have more questions, you can always even jump on to crossfitmetrics.com and ask. We'll get you in touch with Bill. If you're a client of ours, you get those initial injury consultations included. Those are free of charge for you as an inclusion in your membership. If you're not, this is also a public service. So Bill has a space here in our facility. that he sees anybody. You do not have to be a member of our facility, but as I mentioned before, we've had you on here one other time. We're going to continue to have Bill on here because he just has so much great information about staying active. Anything else that you feel like we've missed out on today, or anything you want to make sure to plug right now?
Plug. You can check out our website,
Yeah.
www.myofittherapy.com. You'll see 3 different locations across the country there. We're here in St. Louis. We're in Indianapolis, and we're also down in Atlanta.
Okay, you're not in Atlanta or
I'm not personally, but Myo-Fit.
He doesn't commute that far, but
it would be a lot of fun though.
yeah, I mean, I'd be getting private jets.
Yeah, for sure.
But all right, man. Well, thank you so much. Hope you and your family have a great holiday.
You as well.
And we'll talk to you guys soon. See ya.